Welcome to Reboot with Dr. Arasi Maran, where we cut through the medical misinformation with evidence based insights that could save your life. I'm Dr. Arasi Maran, interventional cardiologist, but today we are tackling a topic that affects 1 in 8 women globally: breast cancer. Breast cancer is not just a diagnosis, it's a delay, it's a misscreening opportunity, a system that has honestly failed someone, or sometimes a conversation that never happened. But that's why. For today's conversation, we have an extraordinary guest. She didn't just research breast cancer from behind the microscope. She walked away from a prestigious career as a cancer researcher to save lives on the ground, one community at a time. Dr. Lopamudra Das Roy was awarded grants from the Department of Defense and National Cancer Institute. Her groundbreaking work included discovering signaling pathways limiting breast cancer spread to different joints. But in 2017, she made a bold decision that shocked her colleagues. She resigned from UNC Charlotte to found a society called Breast Cancer Hub, which provides 100% free screening services globally. Recently, she was recognized as one of the 2025 No 100 Women in America and receiving the NRI Achievers Award as Global Health Humanitarian of the Year. Dr. Dasroy has transformed breast cancer screening from the villages of India to communities across Africa and the United States. Today, we will explore why mammograms miss 40% of cancers in women with dense breasts, why male breast cancer is rising globally, and how the 2025 screening guidelines could save your life or the life of someone you love. Dr. Lopa, welcome to Reboot.
Thank you so much, Dr. Arasi. It's an honor to be here, and I'm so grateful for the generous introduction. That means a lot. Thank you.
Thank you. So, my first question to you, breast cancer kills despite all our advances. We've made massive strides in therapies, right? There is targeted therapies, better imaging, precision oncology, but yet women are dying from this disease. Why?
That's a wonderful question, Dr. Arasi. And that was one of the main reasons why I took the step of resigning and starting the foundation. Because, I'll start a little bit, down the lane, my history. Like, I come from a family of, like, my father was a pediatrician, my grandfather was a physician. So, on the dining table, we always discuss, like when I was a kid, right? So they always discussed about anything and everything about health. There was no taboo associated with even the word breast, because I would hear my dad always talking to the moms about breast milk. But then when I was 12, one of my friend's mother passed away, and I went for the funeral, and even to utter the word cancer, it was a big taboo. And I'm talking about not this part of India, but it's like, unfortunately, it's across India the same scenario. So when
Mhm.
I was always a curious child, and I've asked like to her friends only that how did she die, and even they didn't want to say it was cancer. When I went deeper, I started to ask like cancer where, and after a lot of resistance, one of her friends mentioned like breast cancer, and when I repeated the word, she just hushed me, like she said I'm not supposed to talk about it. So this really left an impact in me, and I felt that this is the respect we are giving to a mother, that we lost her, but we cannot discuss the disease that caused her life. And over the years, my expertise, everything was driven towards the direction of breast and pancreatic cancer. But then I was in Delhi University, and one of the I knew someone acquaintance who passed away from breast cancer. The family said it was brain cancer because they didn't want their daughters to get married. So I just wanted to bring this up, Dr. Arasi, that irrespective of socioeconomic condition, irrespective of education, as you said, right, so much the science has advanced, the research has advanced, but why still we are seeing women or men, all genders, dying from breast cancer? So these are different reasons that I felt that there's a huge gap, because even in the US, I would go for the study section as a scientist reviewer for Department of Defense for the grants and the proposals. And like in the DoD, one beautiful fact was even the cancer advocates, like the patients, they would also come as advocate reviewers, and we would review the proposals as scientist reviewer, and I would meet the women or men, who would tell me how they in the US also they were diagnosed as stage 4 because mammograms missed their cancer. So so it was not just one reason, Dr. Arasi, but I feel that it's our culture because, especially when we come from different ethnic groups, especially in the developing countries, we do
Hmm.
not speak about any issues in the breast because it's more
Yes.
like, the taboo that is associated. That is one of the main reasons. The other main reason is women, especially, they never think of that, their health is a priority because we are always thinking of our family. Family comes first. But unfortunately, even in the developed countries or developing countries, I mean, in the urban sectors, those who can afford, but still they will not go for screening because screening means when we have no issues, we are going for
Yes.
imaging, right? So they
Hmm.
will not go because it's again that I have seen so many women telling me, I don't have anyone in my family. So, the chance, like, why do I have to worry? Even if they are
Right.
aware
Exactly.
about breast cancer. Next
Yes. Yeah.
is many are ignorant too. Like, I
Yeah.
met a woman from India, very educated. She told me, and she was diagnosed as stage 4. And I asked her, like, what happened? Couldn't you feel a lump in your breast? Her response was, I did not know. I did not know that a painless lump in my breast could be cancer. So
That's
it's so
crazy.
many factors, that I feel are the main reasons why even till this date we are seeing death to breast cancer, and the most important reason is inaccessibility to healthcare facilities and proper diagnosis and treatment management, because we are also talking about not just the does the society who can afford the treatment, but we are also talking about the financial challenged communities, the underserved, the underprivileged, where the hospitals in the villages, they are in the primary centers, they do not even have the screening protocol to be
Yes.
performed. And if they have the hospitals which are cancer equipped, they're so far off that the villagers they don't, or the underserved community, they'll not even have the funds to go to the hospital, even if the government has provided many different subsidiary treatment regime. So those are, I feel, the different reasons
Different
at the
reasons.
grassroots that I have faced are the reasons why still we still see so much of death with breast cancer. Of course, like in the developing countries, is significantly higher.
So if I have to kind of go over everything, it's just it's still a number one driver of mortality or number one cause of death because patients come late, and they come late because it's not just access. Even if they have access, there's a little bit of ignorance towards what breast cancer is, and there's still a component of embarrassment that you're talking about your breast, and that's
Mhm.
not a topic which you discuss in public, and therefore how can you go seek treatment for the problem itself, which is pretty shocking, unfortunately.
Yeah,
Now, the if I also, to go, like, if you want to talk about screening, there's a
mhm,
lot of confusion, fear, and misinformation, right?
yeah,
As to when exactly women should start screening.
mhm,
And mammogram is not the easiest thing to do, also. So, can we talk about who should get early screening, and then when is standard screening?
yes. A wonderful question. So every country they set up age limit. Like for example, in the US, the protocol says that when we turn 40, if we do not have family history, I mean, when we turn 40, we have to go for a screening mammogram. Now, unfortunately, I have seen patients in their 30s, in their late 20s, or even early 20s with breast cancer. And they tell me that, they are not in that age group for the screening mammogram, though they're very proactive. Every country has their own agenda. Europe has its own regulations. India, when I spoke to many of the, like, Indian Medical Association, or even in my family, I have gynecologists and everyone. Unfortunately, there's no stringent rule or regulation that is being given as a guideline to the patients that we have to go for a screening mammogram at a particular time period. Another thing that we need to understand, Dr. Arasi, is that mammogram, which is a gold standard of breast cancer screening, unfortunately, not every places it is available, or even
Mhm.
if it's available, is not functional at many of the institutes in India or Africa that I mostly work. Now, as you said, right, when to do it. So, and what to do about it. When to do, I would say that women have breast. The frequency is more definitely after a particular age, but young population are also getting it. So what we need to do is we have to form a comprehensive, like a screening protocol that every woman or men or all genders need to follow. Because from Breast Cancer Hub, I work with not only with women breast cancer for women, but also for men and LGBTQ plus community too.
Mhm.
Because for men there is no screening. With men the
Yes.
scenario is worse than women. Men feel it's a woman's disease, then they are more shy to talk about it. But I always say, even though it is rare, that man is a father, a brother, or the son of the family. So how can we ignore the men? And I have patients with male breast cancer. I work with daily with them, so I know their situation, I know their emotional turmoil, and they have only one regret and question: why we do not have any screening protocol. So I'm going to be very inclusive when I'm talking about the screening. Now I
Okay.
would request that everyone need to go for the clinical breast exam all across the globe, you know
Okay.
from early on, like for example 18 plus or 20, when we are going for a physical. Every man should advocate when they're going for the physical to their primary healthcare system that please do my clinical breast examination, and of course the women and other genders too. The second thing that is very important is that if we have a family history, or if we know that we are susceptible populace, we need to go for our screening mammogram much earlier than the recommended age. But then many, like it on like genetics is only 5 to 10%. What happens to
Mhm.
the 80 to 90% population? I always say that perform breast self examination,
Yes.
because we have to do the BSc every month. The right protocol is not, and then also when to do it. It's not that I
Yes.
just remembered now and I'm going to do my breast exam, right? 7 days post menstrual cycle. For example, if my period starts today, it should be 1, 2, 3, 4, 5, 6, 7, because there's so many hormonal changes that actually happen before or during the time of the period. So 7 days post menstrual cycle. But for those who are at menopause, we just pick a date in the month. For
Month.
men, we
Yes.
pick a date in the month. Next
Mhm.
is that how to do it, right? Because I have had a clinical exam done by me by the physician, and it just gets wrapped up in 2 seconds, like this. That's, I mean, I shouldn't say this,
Not
but
adequate.
yeah, we have to come follow the correct protocol. And many times when I had a male physician to do my clinical exam, I felt that that was quicker, so
Yes.
that taboo needs to be
Symptoms.
broken, right?
Yes.
It doesn't matter who is checking my breast. So next is that how to do the breast self exam. We take our hand behind our head, we stand in front of the mirror and look for any abnormalities. Now,
Mm.
we should always remember that we have to understand the look and feel of our breast to detect any abnormality. Now, and it should start from the age of 17 or 18. I know that the protocol may say 20, 25, 26, but I have had patients, male breast cancer, diagnosed with felt the lump at the age of 18. And from US I'm talking about. I have had patients 17, 18 in Sierra Leone, Nigeria that I work with, India, they are diagnosed with breast cancer. So very early on. So basically, because unless we understand the look and feel of our breast, how are we going to detect the abnormalities, right? So we stand in front of the mirror, as I said earlier, look for asymmetry. If we see that one breast is suddenly becoming larger than the other one, then we, if our nipple is suddenly inverted inside, so inversion of the nipple, then also any discharge from the nipple, like we just press it little bit, apart from the breast milk, any other discharge, bloody discharge, transparent, translucent. If you're breastfeeding, that's a different thing. Then redness around the nipple or pitted skin, or like how the skin of the orange, right? How it is like a
Really
little
orange.
crumbled.
Yes.
So if it
Mhm.
becomes suddenly like that, it's immediately it's a sign of concern. Next, we take our hand behind our head and in a sitting position or on a flat, like many patients told me that they could feel better on a hard surface. So we lie on the flat surface, we take our hand, and we should always remember that we cannot ignore the collarbone. So we should always do the collarbone and also the underarm area. The reason underarm area because of the lymph nodes. And how do we do it? We go from top to bottom and then we just, we say like this is the best machine I can tell you about, right? But then of course we cannot detect it at stage zero. It has to be like lump needs to be felt. We go from top to bottom and then if we feel anything like a marble, like a little bit of hardness which slips in our finger, we just wait for few days. Many times it may dissolve, but if it doesn't, immediately we report to the doctor and we do the screening mammogram or ultrasound. Now, next I'm going to come to about the mammogram scenario. Now, what happens with mammogram is the regular mammogram is just an x-ray of the breast, but we women we also have dense breast, which is fibroglandular tissue. Now, in a mammogram, in an x-ray, which is so basically we are supposed to have mostly fatty tissue. When we
Mhm.
have fatty tissue, the mammogram appears as a black background, and the lump also appears as a white dot. But when we have dense breast or fibroglandular tissue, the background is mostly like white patches. So why are we concerned about this? Because when we have a lesion that also appears as a white dot and it becomes very difficult to find the tumor. It's basically finding a snowflake in the snowstorm. And that's when the cancer gets missed. So 50 to like 30 to 50% cancers may be missed if we have like dense breast. And the dense breast also, it varies. It can be heterogeneous, it can be homogeneous. So we never know, like, but we know that so our dense breast situation is reflected through the mammogram. It helps us to understand the morphology. So in the US, I would request everyone, actually globally everyone, to do 3D mammogram because the regular mammogram has become redundant. 3D means, tomosynthesis. But unfortunately, in the developing countries, 3D mammogram is not available at all, like very rarely. So I always request them that instead of complaining, we should always try to find a solution within the infrastructure that we have. So we can couple the mammogram with ultrasound. Now,
Mhm.
so because when we do that, it because here also in the US, when we do 3D mammogram, if we have any suspicious scenario, then we are being asked to go for ultrasound. Now, in the developing world, I tell them to couple both the imaging system, but then many times mammogram is not even available. So we can
Mhm.
directly go for ultrasound. Now, when I say that, I have had questions from the community asking that why can't we directly do ultrasound even in the US? Now, in the US, insurance will not cover our ultrasound because it has to go through the mammogram. But
Yes.
one caveat is that mammogram helps us with the microcalcifications too, to identify that. So, which is not many times is detectable with ultrasound. But if we are not having a mammogram scenario in the settings that we go, we can definitely do the ultrasound. So in that way, we can definitely close the loop and try our best that our cancer is not missed.
Fantastic. That was so exhaustive. I love it. Thank you so much for going over how should you actually do a self breast exam, and even for men, how they should at least be aware of how the normal breast tissue appears for them. Thank you so much for that. But now I want to move on to the app. Your organization, Breast Cancer Hub, has created the world's first breast self exam app in over 27 languages for all genders.
Yes.
Can you talk us through the app?
Yes, absolutely. So thank you so much. I mean, thank you for reviewing, our work because that's amazing of you. I'm so grateful for that. So this app is first of its kind. The reason is that it's for all genders because we never think about our transgender community too. Because and the
Yes.
way we have done that is that just as you mentioned earlier, 100% everything we do is free. So it's a free app which is available on the Google, on the Apple App Store, everywhere. But the name of the app is BCH. BCH stands for Breast Cancer Hub. Know Your Breast. So BCH Know Your Breast, if you look up, you'll be able to find the the app. Now, the uniqueness of our app is that it's in 27 languages, and every language, it's not a Google translation. It's being done from scratch by our BCH volunteers. And the reason I say for all genders, if you download the app, you will realize it's based on the type of tissue. So we call it like avatar, whichever avatar you want to connect yourself to. Avatar you pick, so that avatar you connect with. So that's how we can connect to all genders. And especially I work with the transgender community too. And I have seen like trans women, because usually with male the breast cancer scenario is less, but with the trans women, they go through so many hormonal changes because of the injections and everything. So they are so much susceptible to breast cancer. So it's a great tool for everyone. And it's a monthly reminder app. So that means that, like we can actually create our menstrual cycle dates, or if we do not have like if we are at menopause or with different genders, we can just pick the date, and then it will give us a reminder. And it gives us like a protocol that, it will tell us like, okay, we are running late to do our breast self exam. So it's a huge life-saving tool in simple words, because it's in our local language. And the reason why I did in 27 languages, because we work in different communities, right? And we'll find it in so many Indian languages, in Africa, in Chinese, in Japanese, in Uzbek, it's like in Urdu, in the Farsi, in so many languages, in German, Italian. So we'll find this Spanish in different languages. So that was the purpose. My purpose is, Dr. RSC, is that simple solutions, how to provide in the hands of the people. And because, in that way we are breaking so many taboos also, because women who are so shy, but if they feel that they can do something within themselves. But the app also has like what to do next, so it will have my contact information, or we will suggest them if you go to the healthcare system, or you can reach out to us. So once they reach out to me, then I can also help and navigate them throughout the process.
What a beautiful work. I mean, kudos to you and your team for doing God's work. Like, seriously, I'm so thankful for women like you,
No, no,
Dr.
it's my pleasure. And I would definitely, this could not have happened without the UNC Chapel Hill Social Good Department, the students, because as per Breast Cancer Hub, we have zero revenue for marketing. So everything we raise, 100% goes to our mission. So even though I had this dream of having this app for many years, I couldn't afford it because we didn't have the funds, or we did not, whatever, as I said, goes for the
Yes.
underprivileged for the screening and treatment. So UNC Chapel Hill Social Good Department, they are young but students who reached out to me that they wanted to do something for us, and I said, why can't we just make an app together? So that's what over every week of discussions, and so I'm so proud of the students. So they, I mean, amazing job they have done.
So, Dr. Lopamudra, let's make it real. Okay, if there is a woman who's listening today, what would she do this week
Mhm.
for their breast health? And if there is a man who's listening to this today, what should he do with regards to their breast health?
One thing, download the app. Download download the BCH Know Your Breast app, and if you just try to see what state of your cycle are you in. If you are a woman who gets their period, if you're already having a period, count the number on the 7th day, do the breast self examination. For men, it's your time. Just pick today, start taking care of your breast health. Next is, if you're 40, if you haven't taken the appointment for screening mammogram, please do the appointment right tomorrow, because it's holiday season. Give yourself the gift of the holiday by doing your screening mammogram, because with breast cancer there are different stages: stage 0, stage 1, 2, 3, 4. So basically, when the tumor is within the duct or the lobule of the breast tissue, we call it a stage 0, which is ductal carcinoma, either in situ or lobular carcinoma in situ. But if the tumor stays for a longer time, it invades the surrounding tissues, and then through the lymph nodes, it travels to the distant organ. So when it is stage 4, it has traveled to the distant or metastasized, it's difficult to cure the patient. So it's very important, and the earlier we detect, the less less aggressive the treatment is, the protocol
Yes.
is, right? So if it's very early on, we don't even need to do the chemotherapy, because with breast cancer, it's not just a blanket treatment. There's so many variables. There is the grade, there is the receptor status, then also
Yes.
like the stage of the tumor, how big the tumor is, and how many lymph nodes it has affected. So that way, we should always remember early detection is the key. Early detection helps save lives. And there is one subset of breast cancer which we call triple negative breast cancer. It is very like it's mostly like it's difficult to target them, because
Yes.
because usually hormone positive or hard to it, we can target the tumor after we finish the conventional treatment. So that's why when we have a lump or something develops, we are not aware, right, what is the group, or even any status, any receptor status. Whatever the situation is, we have to check for the lump, and that's why we have to go for our screening. Now, one more important thing that I always say is that, when we do the breast self exam, which is even when we do our screening mammogram, still we have to follow the protocol, because I
Mhm.
have had patients who did their screening mammogram, and then within like 6 months or 7 months they could feel a lump. So
Mhm.
when I say that, the reason is that, as I said, the grades of the tumor. If the grade 1, 2, 3, if it is grade 1, that means it is slow growing. Grade 2 means intermediate. Grade 3 means very fast
Very
growing.
aggressive.
And the breast tumor cells are not just one type of tumor cell. I have worked with more than 200 cell lines. So every cell line has their own representation. So how do we know, right, when we have a lump, which
Complex.
particular
Yeah.
category it is? So it's always better to be safe than sorry. So if I would request every person who is watching this today, please take care of your breast health. Early detection is the key. I cannot do it alone. We have to come together and step up. And that's why I'm so grateful to Dr. RC for giving me this platform to reach out to, the community.
Yes, I mean you're absolutely correct, right? The most important thing is to know what your normal is. Only if you know what your normal is, when something is different, you will know, oh, this is not normal for me. Let me go ask for help. And how can you know your normal? Only if you go look in the mirror, as you said, or feel. So to summarize what you said, download the Breast Cancer Hub, Know Your Breast app, then actually get to know your breast, whether you're a man, woman, transgender, whatever it is, get to know your breast. And then based on that, based on your age group and family history, schedule your mammogram. Know your family history, parents, grandparents, grandmothers, what has happened to them. Then don't hide and suffer in silence. There are ways to reach you online, and you have been generous enough to put your contact information on the app
Everyone,
itself.
anyone, and everyone can reach out. It's on Google Breast Cancer Hub. The phone number is there, so I
That's
can.
right.
And
you know,
then WhatsApp
and
is free, right? So I like will go in
Exactly.
the
So
villages.
share, and don't suffer in silence, and get the help you need. There are multiple organizations, at least thankfully,
Yes,
and
it's
people have,
available.
it's available. So don't suffer in silence. So thank you so much for that. Now let's get to a fun segment. It's a true or false segment. Okay. So
Okay.
I'll ask you questions, and you can give me an answer and kind of go from there. Okay. Question number one. If I have no family history of breast cancer, I can wait till 50 years of age to get my first mammogram. True or false?
False. So we need to, once the moment we are 40, we need to go for our screening mammogram if we do not have a family history. But saying that, we have to definitely keep doing breast self exam from the age of 17 or 18.
Fantastic. Question number two. Mammograms are actually x-rays, and they are radiation exposure, and I am going to end up with cancer from this radiation exposure, and therefore I don't want to do it. True or false?
False. Now, yes, it's true that it's ionizing radiation, but it's very low dose ionizing radiation. So we have to understand that, what is more important for us, to be diagnosed early, or we worry about that low ionizing radiation, which we never even know is going to have an effect or not. So it's important that we definitely go for screening a mammogram. Now, when we talk about those kind of radiation, also, like, we never know we have a background radiation or the environment environment we work in. That even when we work, like I worked in the research lab, we use radioactive materials, so we are always susceptible to so many different carcinogens which can cause cancer. So why are we just sticking to the ionizing, low dose ionizing radiation of mammogram, right? So it's high time that we have to come out of this and go for a screening mammogram.
Absolutely. The discomfort with mammogram is very small,
Yeah.
and the real pain comes from a late diagnosis of breast cancer. And the pain is just not for you, but for all your loved ones also.
Yes.
So
Yeah.
please get your mammograms.
Thank you.
Now, question number three. Men don't get breast cancer and therefore should not do self exams and or should not even talk about their breast health.
False. Men get breast cancer. Breast cancer doesn't discriminate. It happens to all genders. Only thing is that with men, it is much lesser compared to the women because of the amount of breast tissues we have. But definitely, I myself work with male breast cancer scenario, and unfortunately, there is no screening protocol. But that's where we are fighting for, so that we can make changes in healthcare policy. And then with breast cancer hub, definitely we have the screening protocol, which is the breast self exam card, or the app also has for different genders. And if you go to our breast cancer hub website, you will find that we have made breast self exam cards for her and him in 27 languages too. So please
Fantastic.
leverage that.
Okay. Breast cancer in younger women is more aggressive than breast cancer in older women. True or false?
So it depends. I can never say it's true or false because I myself worked with, like every day that I'm working with younger population with breast cancer, which is grade 3, which is the aggressive type, even simultaneously with the older population. I would say like 80% it is like 80% it would be like aggressive type, maybe
Aggressive. Yeah.
20%, yeah,
Yes.
20%
So
like the
maybe it's
grade 2 3.
unfortunately
So
true.
very maybe there's a very it's a gray area,
Okay.
Dr. See, I wouldn't be comfortable making a statement like that where
Sure. Sure.
I
It's
myself
a
I
tough
have
call to make.
worked with the with grade 3 in both the scenarios.
The nurse. Okay. So once I reach age 74, I should stop getting mammograms.
That's again, say according to the guidelines protocols, they say that. I would say that I just today itself I had a patient 75 diagnosed with breast cancer, and she went for her screening mammogram, and that's why she got it caught
It
early.
got early. Wow.
So
Okay.
how do I justify that?
Yes,
Yes,
absolutely.
the frequency definitely goes down, but then it
Yes.
happens, right? And
Yes.
even if we do not, when we are 70, 74, 75, we do not want to go for screening mammogram, it's important. We have to do our physical.
Yes.
If we can definitely go to a doctor, let them do the clinical breast exam.
Exactly.
We perform our breast self examination so that even if we
Sure.
are not wanting to go for screening mammogram, we can definitely have these alternatives. But saying that, as I said earlier,
Yes.
screening imaging will catch it much earlier than breast self exam, which is like usually late stage 1 or stage 2, but then screening can diagnose at stage 0.
Yeah, I mean, I would honestly think of it as a false statement because the 2025 guidelines basically says age is not the determining factor as to when to stop the screening, but it's more of the risk and what
Yeah.
treatments you are on and things like that. And you have to continue screening as long as you're alive. So,
Yeah. Yeah.
well, Dr. Loba, thank you so much for today's episode. You have taught us so many things, and you've reminded us that science with humanity is where real change happens.
Thank you.
You have shown us that beating breast cancer is not just about technology, but about communication and connection. And that's how you are able to break barriers, you're crushing taboos, and you are changing lives with each time that app gets downloaded. So
Thank you.
thank you so much for
Thank
all
you.
your work.
Thank you. And I just want to say, like, that I'm always here for everyone who reaches out, and we not just help with the screening, but we also do the treatment guidance. We have care packages, which are like specialized care packages, which I ship to everyone across US. We have a very private support group with oncologists, with healthcare professionals, survivors, thrivers, everyone. So if anyone ever has any, like if you do the breast exam and if you have any doubt, you can reach out, and we try to be there throughout the process. Like it's like a second opinion, but totally
Sure.
free. So yeah.
Fantastic. Thank you so much for that. And people can find you at the Breast Cancer Hub.
Yes,
Am I
Breast
correct?
Cancer Hub, and my email is lopa@breastcancerhub.org. So anyone can email me. Yes.
Fantastic,
Thanks.
fantastic. So, ladies and gentlemen, breast cancer is just not a women's issue. It's a family issue. It's a community issue. It's a global issue. For our listeners, the take home message is clear. Don't wait, whether you're 40 or 74, whether you have a family history or not, whether you're insured or not insured. Screening saves lives, self breast exam saves life. Download the Breast Cancer Hub, Know Your Breast app. And if you're facing barriers in screening, organization like BCH are here to help. And if this episode has helped you, share it. If it has scared you, act on it. Talk to us. Reach out to me. Reach out to Dr. Lopa. If it has empowered you, pass it on. Your health is in your hands. Don't wait for permission. This is Reboot with Dr. Arasi Maran. And until next time, see you all and take care of yourselves.
Thank you. Thank you so much.